Currently, Mrs. Lamb's vitals appear stable. However, she has an MRSA infection which needs immediate attention. I would like to liaise with a pharmacist on the best treatment for this.
I would recommend we commence a 720 milligram dose of vancomycin every 12 hours and closely monitor.
That sounds great, Zara. We will commence our protocol immediately. Mrs. Lamb also appears to have some dental problems. Michael, as a dentist, is there any complications that MRSA could have on Mrs. Lamb's dental health?
Hey, I agree that we manage Mrs. Lamb's MRSA infection with antibiotics. For dental therapies that are more invasive, there have been cases of infectious endocarditis. In terms of Mrs. Lamb's dental health, she's healthy but just with some bleeding in her gums. After checking her antibiotic coverage, I do supragingival scaling and I'd recommend a high fluoridated toothpaste as well as fluoridated mouthwash. On a more long-term note, I'd perform subgingival scaling over multiple appointments, but only after checking her INR, MRSA status, and antibiotic coverage. Because of her stroke, I'd recommend using an electric toothbrush and water pick, and I'd definitely try to give oral hygiene instruction to your caregivers.
Thanks, Michael. That sounds good.
After reviewing Mrs. Lamb's medications, I'd like to flag potential issues that need assessment. These include the long-term use of PPIs with no apparent indication in her past medical history. PPIs are only recommended for long-term use for a very limited number of indications. In regards to her paracetamol use, again, there is no apparent indication. In addition, she is using a dose above the maximum paracetamol dose. Depending on the indication, the patient can only take a maximum of 2 controlled release tablets 3 times a day.
Thanks, Zara. We will need to discuss this with the patient. Mrs. Lamb's stroke has been acutely treated. However, going forward, I would like to minimise her risk of another stroke or blood clot. I have educated the patient and her family on identifying the early warning signs of a stroke or other blood clots. I'd also like to recommend that she ceases smoking to decrease her risk of another stroke.